Hello, everybody. Hello, everyone, and welcome back again to my beautiful channel. I hope you're doing well, great, awesome, excellent. Okay, on this video, we're going to head NCLEX outline of what you need or to do or what you need to read or important topics that you need to read prior or before taking the NCLEX exam. So like 10 days prior to your test or 5 days prior, you could browse all these topics so it could enhance you a little bit. So without further ado, let's start to do this thing. Okay, the first topic is the laboratory values. You should know it by heart, specifically the sodium, potassium, calcium, magnesium, the levels of that, and also memorize the blood levels, which includes your the WBC, RBC, the platelets, the PT, the APTT. So try to remember all those values and how it will correlate to each other in the topics. Of course, for the numbers, you have to look for your glucose level. It's important, as well as the liver enzymes. So if you had your, the normal values, your notes, just check on that. Then next is a prioritization and delegation, which is very important topic in NCLEX. So prioritization, you had to know everything because they put a scenario or conditions which you would assess who needs first or who needed most of the attention or which assessment needs to be prioritized. So that is for prioritization. And for the delegation, of course, RN, then the licensed vocational nurse or the LPN, and the unlicensed assistant. Okay, so the UAAP. I'm sorry for that. Okay, so the delegation from the registered nurse, from your LPN, and then to UAP. Now, for RN, you had to remember that they are the highest position for that delegating to the LPN. Mostly the assessment, the first assessment, skillful things for nursing, so safety and protocol assessments. That would include for the registered nurse or administration of medication and IV fluid therapy. So that's for the RN. For the LVN, is follow-up teaching, but first teaching should be from RN, while for the LVN should be like follow-up teaching, assisting, but they could also administer medication as well. Okay, for UAP, no skillful nursing except for vital signs. Safety and protocol, of course, all the time, always check for the safety of the client, what is best for the client, doing no harm, what is beneficial. That's the best answer for that. For protocol, we have the standard policy, standard treatment and regimen. So do not, overcome the standard, because it is. So if you choose the wrong answer, then you will fail the test. Infection control. Now, important here is the mode of transmission, such as the contact, universal, airborne, or droplets. So you should know. So we're going to tackle that too. The PPE, the personal protective equipment, the donning and the removing, which comes first, and everything. Legal matters. Domestic abuse is also one of the topic. What do you need to do? What do you need to assess? What do you need to report? And where do you need to report? Legal issues such as the battery, neglect, assault. So what do you need to do? What do you need to what is this? So they give example. So you have to know it by heart. So you will not gonna fail on that questions. And then wrong medications. So what do you need to do? Where do you need to report? So those are the things that we need to consider. Ethical-moral aspects such as the veracity, beneficence, fidelity, and autonomy, they will give a scenario. So you would choose the answer always. Know this individual. So you would give, you will get the correct answer if you know this by heart. Medications and drugs. Okay, now side effects and teachings are very important, such as the following. Okay. Side effects of the following drugs specifically: NSAIDs, digoxin, computation of drugs. Mostly they give like 1 or 2 questions when it comes to computation of drugs. So because I think that's easier to do because you practice it. But for the sake of NCLEX, they give that. NSAIDs also their favorite, and as well as digoxin, so you have to know it by heart. Okay, and psychiatric drugs, their favorite drugs are antidepressant and antipsychotic drugs. So we were going to tackle that too sooner. Also, their favorite is diuretics and antidiuretics, especially like the potassium sparing, osmotic diuretics. So those are example. And also insulin drugs, their routes, their classification, their time of onset, peak hours, and so on and so forth. So we should know that. So they have like how long this affects or something. So we should know this. Then the GIT drugs, common side effects. So and also the nitroglycerin oxygen. So these are some of the common questions when it comes to medications and drugs. So we have to know this a little bit. So as you go on with review with your NCLEX. Now for fluid and electrolytes, we have to know the normal value of the electrolytes, such as your I talked that to you, the calcium, the potassium, sodium, magnesium, and as well as the phosphorus, but mostly sodium, potassium. They're very important. So try to know that normal value and what would happen if they decrease or increase. The signs and symptoms, and as well as the normal values and imbalances regarding that specific electrolytes. Positioning. Okay, now after a certain procedure or a certain disease, you should know what are the basic position that you need to do, because that's a safety and protocol when it comes to the client. So that's why position before and after procedure, we should know that. Check. And then also position and safety with certain disease, we should know that as well. Procedure, check. Position and safety with certain disease, check. And position and safety with the disease and the disorder. So there are certain considerations when we need to do it. That's also their favorite questionnaires. Now for assistive devices, mostly their favorite is crutches, like the 2-point, 3-point, and 4-point gait, and their measurements. For measurements, they're always favorite when it comes to crutches, or either the cane. So you should remember that, because they are always included. This thing, the 2-point, or the 4-point, or the 3-point gait. Remember that, okay? Now for psychiatric nursing, what do we need to consider here? We have, okay, I'm gonna move this a little bit. Okay. Now the schizophrenia. That's one of their favorite. Positive and negative symptoms, remember, okay? Remember these things, okay? Depression, either bipolar, safety, and suicide. They always have question with the bipolar, which includes your suicidal, manic, and hypomanic, okay? So what do you need to consider for their safety, and what do you need to use for their safety as well. Okay, and of course, the non-ever ending or never ending therapeutic communication. This is wide used because you need to focus, you need to give attention to your clients. So that's why therapeutic communication is a heart of nursing. Okay, so we're going to tackle that too. Now, for psychiatric drugs, their favorite also are antipsychotic, okay, and antidepressant. So you need to remember all these drugs. This is always part, okay, of the NCLEX. Next is alcohol and drug abuse and withdrawal. Mostly what the question are withdrawal symptoms when they undergo like rehabilitation. So for alcohol and drug abuse. But I also ask some questions, what is the side effect of this drug when they take like the illegal drugs like cocaine, coke, mepentep, what they call it, hydrochlorides, okay? And also their favorite is anorexia or the bulimia. So know the difference of the two. Always ask this question. Okay, for musculoskeletal, what are their favorites? Okay, includes rheumatoid versus osteoarthritis. So know the difference of the two depending on the site of their affectation. Gout, what's the difference of gout to rheumatoid arthritis? Osteoporosis, so these are always some of the questions like side effect of the drugs, and then as well as what are the effects of this disorder or the disease to a person, especially for women. Fracture, for fracture, I guess like effect of fracture and name. Okay, for musculoskeletal, always either box traction, skeletal traction. Know the difference and how they are positioned. Okay, for box traction and the skeletal. Now they also have their favorite here, the amputation. So what do you expect like with the amputation, with the phantom pain? Check for that. And then after surgery, what do you need to do? And pain management. Okay, next for neurology nursing, it is important to check for the level of consciousness. That's part of our assessment. Okay, like for those who had a head injury, what are the signs and symptoms like headache, projectile vomiting, seizure? You should take consideration of what you need to do after the or during the seizure and after the seizure. Positioning, what do you need to do? Okay, for CVA, it's also their favorite, like for mobility, safety of the client during eating, so something like that. And then encephalopathy, like Wernicke's and encephalopathy. So check this thing, okay? Another favorite of them is the GBS or Guillain-Barré syndrome. So do they have the difficulty of breathing? Do they have paralysis? Do they have the weakness? So we should when they give the disease like this, you need to know how they are their signs and symptoms and what you need to do. Do we need to provide oxygenation or ventilator to this client? Something like that. MG is myasthenia gravis. So what is this disease? You need to know that, okay? The signs and symptoms as well. It's similar with the GBS. Multiple sclerosis is the same as myasthenia gravis. So what's the difference? Is this multiple sclerosis has a problem with sensory? Is this also had a paralysis? So something like that we need to know. Okay, also Parkinson's is one of the favorite thing to do because Parkinson's mostly affect the elderly people. So we have to consider their mobility, how they walk, how they eat. Are they affected with tremors or something like that? Okay, then next is the amyotrophic lateral sclerosis. Is it similar with multiple sclerosis, myasthenia gravis, and GBS? We need to know the difference, know the disease, and then what we need to do. Okay, now next is headache. If you have a headache, do we need to provide medication for pain management? For NCLEX, so we need to get some nursing consideration first, like can we dim the lights? Can we provide something that could relax the client first prior to giving medication? Okay, intracranial pressure, increase ICP is also one of their favorite. What we need to do with this? So avoid like Valsalva, avoid like headache, avoid something that would increase the ICP, proper positioning and everything. Next is autonomic dysreflexes, also their favorite after with spinal cord injury. What do we need to do? What is the best position? And what is autonomic dysreflexion? Meningitis is also their favorite, especially with what kind of mode of transmission when it comes to the disease itself. Is it caused by bacteria or virus? Does meningitis have a seizure? Something like that. Aneurysm is almost like the severe stroke, but aneurysm can be caused by having hypertension or something like that. What are the factors that lead to aneurysm? What do we need to consider? Okay, that's for neurology nursing. Now for cardiovascular nursing, we had to know about angina. Stable or unstable? What are the risk factors of having a myocardial infarction or cardiovascular disease? We need to know the assessment of the either angina versus stable and unstable and leading to MI. So what do we need to consider? Laboratory, and as well as the side effects of the drugs, especially the digoxin or anti-clotting or something like that. ECG, they always their favorite. So we need to know the basic of the ECG. So sometimes they give like 1 or 2 or 3 questions for the ECG assessment. Okay, we need to know also the priority signs and symptoms. Okay, when it comes to right and left heart failure, we need to know that. Okay, and nursing consideration. So next is for blood disorder. We're going to talk about cancer. What would be your assessment? Normally they will ask like a Hodgkin versus non-Hodgkin, so we need to pay attention with that. Chemotherapy. So what do you need to do? Like for lead precautions, do you need to pick it up by your own hands or get something that will protect you? Anemia. This is also the classification of anemia, like pernicious, sickle cell, aplastic, iron deficiency anemia. Mostly, I guess, like pernicious, sickle cell, so thalassemia. So those are some of the their favorite questions. So we need to know that. Now for HIV, it's also one of their favorite topics, like assessing the client, what are the signs and symptoms, and also the level of CD4. So check with that. And precautionary measure. Okay, and for hepatitis, also their favorite when it comes to the transmission, either hepatitis A, or it would be like for food, the contact, or someone's working in the hospital, or food or something, and bloodborne, it comes from the blood, so have the precautionary measure when it comes to hepatitis A and B as a healthcare worker. GIT system. Okay, for GIT system, we had to know GERD, or the gastroesophageal reflux disorder, what position, what food that you need to avoid to prevent this. Check on that. Acute pancreatitis is also their favorite. You need to know what's this disease and how will be prevented and what are the nursing consideration or treatment for that. And also Crohn's disease and ulcerative colitis and diverticulosis. Crohn's and versus ulcerative colitis. Check on that too. Know the disease. And then we also the celiac disease, the diet and the food, allergy. Check on that too. Then peptic ulcer and gastric ulcer, the difference of this. Check on that too. Know the difference. And also cholecystitis, or those who had like surgery because of the stone on their gallbladder. Check on that too. Remember that, especially what pain. Okay, what is the location of the pain? So like a differential diagnosis. Check on that too. Then also appendicitis, the difference between the two, where would be the pain located. Check on that too. Okay, remember that. Okay, for pulmonary nursing, now we would assess a COPD versus your CRPD, like a chronic obstructive pulmonary disease, and then your chronic resistant pulmonary disease. Obstructed pulmonary, like your asthma, that's also their favorite. So what can we do with that? Okay, emphysema is also their favorite, like those elderly people are thin and they're coughing all the time. What do we need to do? What do we need to consider with this? Or restrictive pneumonia is also their favorite as well. Like if they have like difficulty of breathing with rusty sputum. Cystic fibrosis, remember this one always their favorite. It affects the kid. Okay, with cystic fibrosis. Okay, it's not only for adult. The cystic fibrosis also considered as pulmonary and GIT problems. So know the disease and how it affects for the kid, and what teaching could we give to the family or to the mom or dad or the parents. TB, the tuberculosis, and the test. Know this all the time because they have the test. What is the confirmatory? What do you need to do first to assess, and what is a specific test that will diagnose that you would have the tuberculosis? Okay, remember that. And when you do the PPD, like the skin test, how many millimeter and what are the positive signs and symptoms when you do the PPD test? Okay, and then do we need x-ray for this? Okay, know that. Okay, epiglottitis, remember this. Is this an emergency? Know that as well. So what do you need to do when you have epiglottitis? Don't just stay home. Go to ER or the hospital immediately. Is this an emergent? Definitely yes, know that. Okay, for the assessment, treatment and nursing first priority, know this too. Read about incentive spirometry, because they have some questions regarding about that could help you how to answer this thing. And of course, the never-ending ABG analysis, arterial blood gases. It's easy. This we're going to tackle about that too. So the analysis of your blood oxygenation level. So on ABG, you don't need to know. For NCLEX, you don't need to know like compensated, uncompensated, or something like that. Know the basic. So if that would be like respiratory, metabolic, alkalosis, and acidosis. Okay, so that's how it is. Endocrine, I know this one also hard because like there are a lot of signs and symptoms that you need to memorize. But I will give you an idea of what you need to study with this, like Cushing versus Addison, specifically what electrolytes is missing, and as well as the signs and symptoms. Don't confuse with their opposite signs and symptoms. So who is fat here, who is thin, who is stressed, what hormone are affected. So just don't know those things, then it will help you. Okay. And then hypoparathyroidism and hyperparathyroidism is different from hyperthyroidism, hypothyroidism. Parathyroid hormone is affected here. They also ask the question, which is the calcium is affected. Okay. What would happen if they're hyperparathyroidism or increased calcium on the blood, or hypercalcemia? Okay, then hypothyroidism and then the hyperthyroidism. See, who is the person who is so thin and who is so fat, who have low metabolism, okay, who are bulging with the eyes, who have the bulging of the thyroid gland, so know that too. And for the SIAD, or increased antidiuretic hormone and diabetes insipidus, okay, see, who is the person who are always removing water, polydipsia, polyuria, polyphagia, okay, know those things. And of course, don't forget the diabetes mellitus teaching, okay, who need to wear socks, give lotion, don't trim the toenails or something like that. And of course, the medication, the insulin, what part of the body, okay, and also the classification, which are regular, insulin, when, what time is the medication to be given. Don't forget those. Okay, it will and always have those questions. Okay, for genitourinary system, okay, they always have questions about this, like acute kidney injury versus chronic kidney injury. So know the difference with acute kidney injury and the chronic kidney injury. Okay, so dialysis, they also have some questions of what's the purpose of dialysis, what do you need to do after the person is having dialysis and then suddenly he or she fainted. So what do you need to do, what do you need to assess with the injection of the fistula or something like that. Also, their favorite, check this one, is the BPH, or benign prostatic hypertrophy, for male, elderly, or male elderly. So always, is the bladder affected here, the urination, what position, after injury, what do you need to consider after like surgery, the blood clotting or something like that. And also consider the nephrotic syndrome. Just know the signs and symptoms of this and what the nursing teaching that you could give to the client. Now, elderly people, they also have plenty of questions with that, like dementia, oh, I got a wrong spell, dementia and Alzheimer's disease, okay? Alzheimer's disease, the signs and symptoms, if they're wandering around, what do you need to do? Can we restrain them without a doctor's order? Can we do something like if the clients prioritize the safety? Okay. Then hearing and hearing aid as well. If the hearing is affected, can we talk to them loudly, or what do we need to do? Check the lips of the client is talking. Hearing aid also. And what if the client has hallucination, wandering, of course, the safety of the client. So those for elderly, especially their mobility and safety is a priority for this client. Now, for maternal and child health nursing, what do we need to do to consider? Okay, for pregnant women, check the trimesters. What do we need to first, second, and third? What are the changes? What are the dangers of pregnancy, bleeding, and something like that? Okay, do they have their, of course, like the bleeding? That's what I've said. Okay, now abnormalities of pregnancy. They have their favorite, which is the ectopic pregnancy. So notice the difference of these three. placenta previa, abruptio placenta. So know the difference, what kind of bleeding was painful, was more bleeding, increased bleeding, okay? Then also remember the pre-eclampsia. So what do you need to do when the client's having what are the symptoms of pre-eclampsia? Then if the client's have eclampsia, what do you need to do? Okay, then don't forget the magnesium sulfate. Now what do you need to consider here? Before administration, what do we need to assess? Like knee jerk or the knee reflex, the vision, what else? The respiration, so something like that. For newborn, we have to check if the client is well, is it warm, APGAR, don't forget that. Okay, APGAR score, reflexes, the normal reflexes, developmental milestones for kids, and the vaccine. Okay, don't forget those. These are important matter. The vaccine that could be given first, like 0 to 2 months or 0 to 6 months, what do we need to give? And how about or 12 months, what do we need to give? Okay. Next, see me so I can see you, like the skin, eye, and ear. I mean, this is C, okay? Skin, eye, and ear, okay? Just for a little bit. Okay, now for skin, Lyme disease. They always have pressure ulcer, like the level of pressure ulcer from 1, 2, and 3. Okay, if this will have the redness or have the blister or something like that. Burns, always I want you to burn you. Okay, the rule of 9s is always, don't get mistakes on that. It's very easy. Okay, but you have to study. Okay, if you study well, then it's always here. You can easily remember that. Allergies, allergies like latex allergies, and as well as skin allergy, but mostly what are the symptoms of latex allergies? For the eyes, blindness is one, like the focal blindness, retinal detachment, glaucoma, so cataract. Don't forget the difference between the three, like retinal detachment who had like a curtain vision, so something like that. Glaucoma has increased pressure that is painful or less painful. Cataract is painless, who had halos or who has opacity of the lens of the eyes. Know this, and as well as the proper positioning after they have surgery. Okay, and installation of the eye medications. So what you're gonna do when you give the medication of the eye. Okay, next is the ear. For the ear, hearing aid for adults and a kid had problem, tinnitus or ringing or buzzing of the ears, otitis media, Meniere's disease. Now, what you need to understand here is the medication installation. So for versus child and adult. So there's a difference on that, so know that. Okay. Now for skills in nursing, what do we need to consider here is the many. Okay, but try to read, because most of the time they need to ask what is this and then the procedure. NGT, TPN, insulin procedure, administration, where it is, the peripheral venous access or the IV fluid, okay, EEG and ECG. So talk about that. Pacemaker, what do you need to consider? If the client has pacemaker, can you go with CT scan, MRI, can do something exercises, or can you do like a CPR, something like that, or okay, sterile technique. Okay, so the sterile technique includes, especially with the PPE, like a gloving, something like that. You need to know that. Okay, know the basic procedural laboratories and like CT scan, MRI, and X-ray. What are the purpose of this? Okay, ABG, I have talked about it. Blood transfusion, don't forget about that. So do we need witness? How many minutes do you need to be there? Okay, what are the complications of blood transfusion if there are mismatch of the blood transfusion? That's why you need to check first if that's compatible or if that is the client. Tracheostomy care, okay, and then the chest tube. Also, they always have here like where the bubbles like intermittent or the bubbles just stay there. What would you do if the chest tube is placed to the client? So something like that for the skills of nursing. Actually, there are many, but these are some of the few things that we need to know. Okay, for emergency nursing, triage, which will be your priority for the client, same as like the prioritization, and then mass triage when there are like accident or chemical explosion or something like that, and your airway and breathing circulation is always a priority when it comes to decision with the prioritization. That would be all. I hope that you would have an outline for doing your NCLEX. So this is what I do on my test. So I write it down, all the topics that I need to. So after I review all these things and then the practice test. So what I do is after I finish that, like 10 days prior to the test, I just outline what I need to read. So try to consider this, and therefore on your notes you could see and scan easily, and you would refresh with your memory. So like 4 days or 5 days prior to your exam, you could do that. So I hope this could help you a little bit, and thank you so much for